First of all, I would thank Critical Care Nurse for this great opportunity. I'm Filippo Binda and I've been a critical care nurse since 2010. I've always worked in the intensive care unit of Ospedale Maggiore Policlinico in Milan, Italy. Meanwhile, I've also completed a Master Science degree in critical care nursing. Working in the ICU of a university hospital allowed me to understand many aspects of critical patient care, especially for patients with respiratory failure. In fact, my hospital is a referral center to treat ARDS patients, and it's also specialized in advanced therapy like extracorporeal membrane oxygenation and prone positioning. Colleagues and I have decided to describe our experience writing this article because never before the pandemic this procedure was used so frequently, even in centers with a lot of experience. I think there are at least three key messages in our article. The first is that the team experience is crucial to perform a safety maneuver. The second one, related to the first, is that the preparation of patient and using all the necessary equipments allow to avoid the most part of complication. One possible complication connected to the second key message is the correct position of head and limbs to prevent the risk of neural tissue injury. Body position, in fact, is really important also to prevent the onset of pressure ulcers. The education program was fundamental, in particular for nurses with lower experience in critical care. The ICU staff were helped by nurses from the operating theater or new nurses without a proper background in advanced treatments of critically ill patients. Respecting all the rules of social distance, full immersion courses were organized for the new staff, and the main aspects of critically ill patients' care were explained. In particular, one of these aspects was about the prone position and the right procedure to follow and avoid complication. The most important aspects were also summarized in a bedside algorithm, and the safety of patients was always guaranteed because in every shift there was at least one experienced critical care nurse in order to guarantee the correct procedure and care. The use of pronation, as described in our article, has been implemented in many patients admitted to our hospital during the pandemic. Normally, this procedure was applied in patients with a better PF ratio. Instead, due to the high number of patients admitted and the limited human resources available during the pandemic, it was used like a rescue maneuver. By being a referral center, this procedure was used much more frequently than the other hospital because the patients in worse condition were transferred to our center. This aspect is very important because it could explain the high mortality rate in our center, especially for those who treat in prone position. First of all, it was possible to take care of so many patients admitted to our center only thanks to the deep experience of our resident staff in management of ARDS patients. Obviously, there were some problems because before this era, only expert personnel performed the maneuver, while during the pandemic, even nurses and doctors without enough experience performed the procedure. Our main key point was at least one senior critical care nurse actively cooperate for every maneuver and checking the preparatory phase. Despite the emergency situation, we were able to use a fundamental device to perform a safety maneuver for patients. In fact, we use an anti-bed sore mattress, and this facilitates the nursing work and reduce the onset of complications, such as the pressure injuries.